Hello and welcome to another episode of the SITREP. Today we're talking different aspect of mental health. We're talking about PTSD, bipolar, therapy, all different types of topics. And today we are joined by Dr. Meg Martinez. Meg, thanks so much for joining us.
Happy to be here. Thanks for having me.
So Doc, a word that I think all Americans are very familiar with, and that word is anxiety. What exactly is it? Like, what's going on?
I'm glad you asked this. Anxiety is probably the most common thing that brings people into my office. It's actually, anxiety disorders are the most common of all mental health disorders. So this is like our bread and butter. I think of anxiety as being a close cousin of fear, right? Like, fear is that sensation that you have when you are staring down a threat, whether that's a rogue tiger or an enemy combatant or an oncoming vehicle, right? Fear is that in the moment, something is wrong, my life is in danger. Anxiety is that feeling, but it's future oriented. So it's sort of the anticipation that something bad could happen in the future. And it takes lots of different forms. And this is why there are so many different anxiety disorders. They all are distinguished by what the person is anxious about.
And it doesn't necessarily mean that you're anticipating your life being threatened, but I mean, it could be an interview for a job or anything like that.
Right. For somebody with social anxiety, it might be public speaking, the fear of being evaluated or judged by someone else. For somebody with obsessive compulsive disorder, it might be the concern of fear of contamination or worry about contamination. There's lots of different, anxiety can latch on to lots of different things. The important thing that I want to note, though, is that anxiety in and of itself is not pathological. Anxiety is just a part of being human. And in moderation, it's actually a really good thing, right? Like, this is why world records are set when athletes are sort of in competition, not just when they're practicing at home. There's something to be said for having that little bit of pressure. It in moderate doses enhances our performance. Where it becomes problematic is when it's sort of too much in intensity or in duration, that it actually can become disabling and unhelpful.
And keeps us from performing.
Right. Or keeps us from trying.
Okay. So, there's obviously individuals who are experiencing, a weakened amount of this to moderate to just through the roof, right? In a general sense, is this something that can be easily managed? And if so, how? Yeah.
So I'm glad that you used the word managed, because again, like when people ask, well, can you cure this? Like, can you fix this? I tell people having anxiety doesn't mean that there's something wrong with you. It just means that you're human. And so I'm not going to take away the anxiety. I wouldn't want to do that. In fact,
you would be inhuman if you didn't have any anxiety.
You would get into a lot of trouble. There have been, case reports of people who have had damage to the part of their brain that controls the fear and anxiety response. And it turns out if that part of your brain isn't working, like, you get into a whole lot of trouble. So I don't want to take away your anxiety. And yes, absolutely. There are ways that you don't have to let your life be run by anxiety. There are medications that can help sort of dial the anxiety down. And there are strategies that we can use in therapy that achieve the same end.
And is there a specific type of therapy that is better than most for individuals who are experiencing anxiety?
So I'm a little biased in this regard, but my personal opinion, and there's a lot of science to back this up, would be something in the field of cognitive behavioral therapies. And there are lots of different iterations of cognitive behavioral therapies, or CBTs, but all of these are treatments that aim to help us change the way we experience emotions by changing either our thinking, our cognitions, or our behavior.
And does that include individuals who have like issues? They have anxiety about getting on a plane or what have you. I mean, when it comes to avoidance, CPT would address that, or is there something else that might work better?
We have CBTs for all of those, cognitive behavioral therapies for all of those. And you're right in that, a lot of these problems with anxiety are maintained by avoidance, right? We're anxious about the thing, so we don't do it, which keeps us from learning that maybe we can do it, or maybe it's not as bad as we think, or maybe we're more capable than we realize. So exposure is an often included component of these therapies.
But you don't throw them in with the sharks.
You can do that. It works, but most people don't like that, so we generally don't.
Doc, thanks so much. And for anybody in the audience that's looking for additional information on this topic, be sure to check out the video description below.
Hey everyone, connecting with your benefits is our primary mission, and the SITREP offers more options than ever. Subscribe to our email newsletter, subscribe to our podcast, or subscribe here on YouTube. For details and links, check out the description below.